High blood pressure is a silent killer, but some foods in your kitchen can work like natural remedies. Today, I'll show you 10 scientifically proven foods that help lower blood pressure and explain why they work. Are you ready? Let's take a look at these natural powerhouses that can help protect your heart. Don't forget to like and subscribe.
1. Dark leafy greens, spinach, kale, arugula, chard. Rich in dietary nitrates, boosting nitric oxide production relaxes blood vessels. Provide potassium, calcium, and magnesium, helping regulate blood pressure. High fiber supports insulin sensitivity and weight control, indirectly lowering BP. Antioxidants in A, C, K, and folate improve endothelial function. Can be easily included as salad, smoothie, or sauté during the week. One serving, 1 cup raw or half a cup cooked, is enough to see effects when eaten regularly. Strong antiseptic mouthwashes can reduce nitrate conversion, so avoid overuse. High in vitamin K, so people on warfarin or similar anticoagulants should consult a doctor. Avoid packaged salads with added salt. Choose fresh, minimally processed. Pairing with vitamin C-rich foods can enhance nitrate benefits.
2. Beetroot or beet juice. High nitrate content leads to rapid and significant systolic and diastolic BP reduction. Works within hours by producing nitric oxide and dilating blood vessels. Regular intake over weeks may produce longer-lasting effects. Both fresh beets and 100% beet juice are effective. Watch dosage in supplements. May improve exercise performance and cardiovascular health. May cause harmless red discoloration of urine or stool, beta-urea. High oxalate content. Caution for people with kidney stone history. Those with low BP or on antihypertensive meds should monitor closely. Can be consumed as salads, smoothies, or 150 to 250 milliliters daily beet juice. Consult doctor if taking nitrate-based medications to avoid additive effects. 3. Blueberries and other red blueberries. Rich in flavonoids, anthocyanins improve endothelial function. Regular consumption shows small but significant reductions in systolic and diastolic BP. Strong antioxidant effects reduce vascular inflammation. Short-term studies show improved arterial stiffness. Recommended serving, half to 1 cup fresh or frozen per day. Avoid sweetened processed berry products. Stronger effect may be seen in metabolic syndrome or prehypertensive individuals. Supports weight control with fiber and nutrients. Combine with yogurt for added probiotic and nutritional benefit. More large-scale studies are needed, but daily inclusion is beneficial. 4. Fatty fish like salmon, sardines, and mackerel. EPA and DHA, omega-3 fatty acids, help lower BP. Most effective at 2 to 3 grams per day range, preferably from whole food rather than pills. Anti-inflammatory effects support vascular health. Recommended 2 servings per week, 120 to 150 grams per serving. Discuss supplementation with a doctor, possible AFib risk and drug interactions. They also lower triglycerides, reducing overall cardiovascular risk. Canned fish is a good alternative, but check sodium content. Plant-based omega-3 ALA has limited conversion to EPA and DHA. Fish-allergic individuals should seek other sources of healthy fats. Choose sustainably sourced fish when possible.
5. Oats and beta-glucan whole grains. Beta-glucan in oats improves cardiovascular risk factors and lowers SBP. Whole oats are better than refined grains for BP and lipid control. A typical portion is 30 to 40 grams, 1 cup cooked oatmeal. Fiber promotes satiety and supports weight loss, indirectly lowering BP. May improve gut microbiota and metabolic health. Helps glycemic control, beneficial for diabetic hypertension. Choose unsalted, unsweetened oatmeal products. Combine with milk, yogurt, fruit, or vegetables. Gluten-sensitive individuals should choose certified gluten-free oats. Works as a dietary aid, not a replacement for medication.
6. Garlic. Aged garlic extract has shown significant SBP reductions in trials. Likely works by vasodilation, ACE inhibition, and anti-inflammatory effects. Both raw garlic and standardized aged garlic supplements were studied. Effects appear after 4 to 12 weeks of daily intake. People on blood thinners should be cautious due to bleeding risk. Cooked garlic is gentler for sensitive stomachs. Choose standardized supplements for consistent results. May enhance the effects of antihypertensive medications. Consult doctor. Easy to include in meals. Avoid salty garlic seasoning mixes. Get professional advice before long-term supplementation.
7. Nuts, walnuts, almonds, hazelnuts, pistachios. Rich in unsaturated fats, arginine, and magnesium, support vascular health. Meta-analyses show slight SBP reduction with regular consumption, especially walnuts and pistachios. Recommended serving is 30 grams per day with mindful portion control. Choose unsalted, uncoated nuts. High satiety effect helps appetite control and weight management. Anti-inflammatory properties lower long-term cardiovascular risk. Avoid if allergic. Prefer whole nuts rather than extracted oils. Mix varieties for better micronutrient diversity. Calorie dense, so keep portions moderate.
8. Legumes, beans, chickpeas, and lentils. High in fiber, plant protein, potassium, and magnesium, linked to lower BP. Daily legume eaters show lower hypertension risk in studies. Low glycemic index, good for weight and blood sugar control. Replacing animal protein with legumes reduces cardiometabolic risk. Choose unsalted or low-sodium canned versions. Improve gut microbiota and reduce inflammation. Affordable and practical. Half to 1 cup cooked several times a week. Gradually increase intake and cook thoroughly to prevent bloating. Potassium content supports electrolyte balance. Works best as a part of a long-term dietary pattern.
9. Low salt and fermented dairy, especially yogurt. Low-fat yogurt consumption linked with lower hypertension risk. Provides calcium, potassium, and bioactive peptides that regulate BP. Probiotic-rich yogurts improve metabolic markers. Daily serving, 125 to 200 grams is practical. Choose low-salt, low-sugar options. People with intolerance or allergy should opt for alternatives. Combine with fruit or greens for extra nutrients. Fermentation may improve nutrient bioavailability. May support endothelial function and reduce inflammation. It should be part of an overall healthy diet, not a cure-all alone.
10. Dark chocolate or cocoa greater than 70% cocoa. Cocoa flavonols, epicatechin, increase nitric oxide promoting vasodilation. 2 to 4 weeks of use shows 2 to 4 millimeters of mercury drop in SBP in trials. Effect depends on high flavanol content and portion size. Choose low sugar, high cocoa bars, 20 to 30 grams. Overeating leads to weight gain, which worsens hypertension. Improves endothelial function with regular use. Avoid high-sugar milk chocolates. Sensitive individuals should avoid late-night consumption, caffeine. Dark chocolate has a stronger effect than processed versions. Larger trials are needed, but short-term benefit is promising.